Ever glanced at a prescription label and felt overwhelmed by the complex, scientific-sounding names staring back at you? It often feels like a foreign language, but there is a hidden code buried right in the names themselves. The secret lies in the suffix, the final few letters of a drug name, which acts as a functional label. By learning these simple patterns, you can instantly identify a medication's class and understand its primary purpose. Let us begin with the suffix olol, which identifies a group of medications known as beta blockers. These are frequently prescribed to manage high blood pressure and various heart-related conditions effectively. Think of common names like metoprolol or atenolol, which are staples in cardiovascular care today. They function by blocking the effects of adrenaline, which helps to slow your heart rate and reduce strain. Next, we encounter the statin suffix, a group you have likely seen on many cholesterol-lowering prescriptions. Drugs like atorvastatin or simvastatin are widely used to keep your cardiovascular system clear and healthy. They work by inhibiting a specific liver enzyme that is responsible for the body's natural cholesterol production. Moving into the world of antibiotics, the suffix -silin is perhaps the most recognizable classic in medicine. Think of penicillin or amoxicillin, which have been used for decades to fight off stubborn bacterial infections. These powerful drugs work by interfering with the ability of bacteria to construct their protective outer cell walls. By preventing this construction, the medication effectively stops the bacteria from growing and spreading throughout your body. Another vital group is the pril suffix, which identifies medications classified as ACE inhibitors. Examples such as lisinopril and enalapril are commonly prescribed for managing hypertension and protecting heart health. These medications help relax your blood vessels by preventing the production of hormones that cause them to narrow. Now, consider the sartan suffix, which is associated with angiotensin receptor blockers for blood pressure control. Drugs like losartan and valsartan are essential for patients needing to maintain healthy vascular pressure levels. They block the action of specific chemicals that tighten blood vessels, allowing blood to flow much more easily. For those suffering from chronic acid reflux, look for the prazole suffix on your medication packaging. Omeprazole and pantoprazole belong to a class known as proton pump inhibitors, which are highly effective. They work by significantly reducing the amount of acid produced in the stomach, providing relief from heartburn. Finally, the triptan suffix is a key indicator for medications used specifically for acute migraine relief. Sumatriptan is a common example that helps ease the intense, throbbing pain associated with severe migraines. These drugs work by narrowing blood vessels in the brain while blocking specific pain pathways. This dual-action approach helps to stop a migraine in its tracks before it can fully develop. Understanding these suffixes is a powerful, practical tool for patients and students to navigate pharmacology. It turns a confusing list of ingredients into a logical system that makes sense at a glance. However, always remember that while these patterns are helpful, they are not a substitute for professional advice. Always consult your doctor or pharmacist to discuss your specific medical needs and potential side effects. They can provide the necessary context for why a specific medication is right for your unique health profile. Keep this guide in mind, and you will find that reading medication labels becomes much less intimidating. With a little practice, you can demystify the medicine cabinet and take charge of your health knowledge. Stay curious, keep learning, and use these patterns to better understand the world of modern medicine.